Our next speaker was to be here, but then due to personal matters, he was unable to. And he was on the 28th with us at the Doctors Association, wrapping up the event. But then, even though he has been unable to come, he wanted to briefly talk about the law on the rational use and guarantees on medications. And Mr. Sanchez has always been a good friend of ours, a lawyer, PhD in health sciences. He was Secretary General of Healthcare back in Celia Villalobos times. But then, since we don't have much time, don't know how, please, if we can show a short clip of him. Good morning. I would like, first of all, to thank the organizers of this international OAFI Congress. I think that in recognition where recognition is due, and because of the hard work put in their daily activities, but also in this type of events, I think that this is quite something to be appreciated, and appreciated by us all as patients, as something that's a meaningful contribution. Unfortunately, I will not be able to be here with you, but I would like nevertheless to bear witness on something that's been of concern to OAFI, and that's the treatments with drugs. Last June, the government reported a reform on the law on guarantees and use of medication drugs. And this is something that's crucial to patients because indeed there have been dire situations where we have had to wait for some problems to be sorted out. The document that was submitted to the scientific on patients' organizations and healthcare professionals is somehow an ambiguous document. But when it comes to patients, there is some extremes, some ends that are important, and we believe that it's important that when this Spanish law that has been announced becomes effective, these critical areas are finally sorted out. The first is the access or the incorporation of new medications and medications in general to the portfolio of services and to the incorporation without any hiccups.
There's been a stage of uncertainty where patients have seen administrative decision without having the opportunity of being involved in them. That is why it's not a surprise that OAFI, as other patients' associations, have requested and demanded to be involved in the process that concludes with the incorporation or, if applicable, the maintenance of the pharmacological treatments. Secondly, decisions in terms of deadlines and periods are within a certain administrative limbo. People do not know when these periods will come to an end. There is a reference in our legal framework of 90 days, but sometimes 300 days are exceeded to see how a drug can resolve these types of issues. And on the other hand, once the drug is already included in the service portfolio, the maintenance thereof is decided, and sometimes, quite often, there are assessments and reassessments that are made by some regional autonomous agencies. And these assessments and reassessments contribute very little, just a waste of time. Now, why do I say this? Because if a drug has been authorized by the Spanish Medicines and Medicinal Product Agency or by the European Medicines Agency, I think that should suffice to provide enough guarantee, quality, and efficiency. Another barrier that patients see with concern and distrust is the emergence of protocols and therapeutic guides that determine whether the drug will be administered in some cases and not in others. Regrettably, these protocols are inspired with pharmacoeconomic criteria and not so much on effectivity concerning results. That is why we believe that this can give rise to differences in access to drugs. This is the so-called lack of equity or territorial inequality. Both things occur once a law, like the General Healthcare Law of 1986, establishes that there can be no discrimination owing to territorial reasons between patients when it comes to accessing or being awarded drugs. Similarly, the law on guarantees that is in effect states so, but we see this with little success. The document I referred to, and the government has made public, says that measures have been adopted to correct this. But the truth is that those of us close to the patient movement do not see these things in a tangible manner, in a relevant manner. The document also includes a reference to the reference price system. In essence, we always approach this complex issue of prices and funding, or financing. We are concerned that at the end of the day, the reference price system ends up cutting the powers of prescription of the doctors, and as a result, it prevents doctors from making decisions when prescribing certain drugs or the most suitable treatment for the recovery of a patient. These are just some of the topics and problems that are of concern to us, but I believe that in addition to touch on the problems, we should also contemplate in the future law some guarantees, new specific guarantees. They should not be new. They should have already been included in the law of guarantees, honoring their name, or its name. I'm referring to the guarantee of informing the patient of the therapeutic alternatives available for the treatment that is most convenient for them. Guarantees of providing comprehensive information, and in the event of any modification being made, it should be made with the patient's consent. And also that the information be given on the monitoring that can be done of all the various therapies. There are others, but I wouldn't want to provide too much information. I would be happy if we could see these, and that they would be accepted by OAFI, so that we could be happy seeing these new legislative developments being included. And this has led to some changes in the ministry, and we would like to think that these changes will be for the better. That's all from me. Thank you very much. And once again, my very best wishes for Dr. Vergés, his team, and all of you. I wish you the very best for this amazing international OAFI conference. Thank you very much, and have a very good morning. Thank you, Dr. Julio Sánchez Fierro. He was unable to be here, but Dr. Vergés and OAFI had a gift for him. We would like him to receive it. So, Dr. Vergés? Yes, I would like to thank Dr. Sanchez for his presentation. Since he sent this video, it's much shorter, but Dr. Julio Sánchez Fierro is one of the persons who influenced the most so that the patients in this country can have more possibilities. He is a person with extensive knowledge on the matter, and he has always supported us. He still supports us. So it's a shame he couldn't make it, but we had a surprise for him. You know, the Tree of Life is something that we give to those who made a notable contribution to our efforts. So we would like to give this Tree of Life to Raquel Sánchez, her daughter. She will be joining us in the next panel. So please, Raquel, give this gift to your father on behalf of the entire organization of OAFI. Thank him for his work and his efforts. Thank you. I would just like to say that, as Dr. Vergés said, this is a true surprise. My father will be surprised when I take this to him this evening. I will go from the station to his home. because my father loves to talk. Had he known this, he would have prepared a speech that I would have read in his name. So I would like to convey his thanks. I'm sure he will be thrilled to receive this gift. You know that you always have a tireless partner. Let's continue. Let's continue with this. Thank you. Just leave. You can leave that there, Raquel, and you can come back, because now we're going to talk about osteoporosis in our next panel.